Hi, good afternoon. My name is Ora Soto. I am in Milwaukee, Wisconsin. The time right now is about 5:30 p.m. I'm just doing my first video for my class on Unit 1. Unpacking your map instruments and the flashcard. So let's see what I got in the mail. So first thing, again, my name is Aura. I'm from Milwaukee, Wisconsin. It's about 5:30. I'm original from Nicaragua. I actually work as a lead medical assistant in a hospital right now. I have worked as a medical assistant for the last, I'll say 16 to 17 years. And so when I got this chance to take classes for surgical tech, I jumped in at the opportunity just because I wanted to move on. I had a lot of fun. I still have a lot of fun working as a medical assistant. I get to see and do a lot of different things. I work in the OB department, OBGYN department. And so I get to do a lot of things in here, procedures, mini procedures, small procedures, in-office procedures. And so I'm a little familiar with some of the instruments, and also I know weight, or the weight how to sterilize. I used to do autoclaving too. I did take some training on that. But since I work in the hospital now, we don't do any of that. We send our instruments down to the central processing department. My glasses are fogging. Okay. Okay, I'm gonna start by taking out the instruments. I had a good time actually opening the big box. It was heavy. So first thing I have in here, we have here a single bassinet. And then inside, let's see what I have inside. I don't even want to open. Inside I have a bowl, a CSR wrap, emesis bassinet, a medicine cup, and a rain bassinet inside here. This is sterile for me, so I don't want to open it yet until I need it. Okay. If I wanted to open this, it will have to be opened through this side here, okay, in order to be sterile and put it on the sterile table. Okay, so this goes on my table. This is my extra bag that I had, my gowns, my apron, my mask I have here, and of course the gloves that I'm gonna use to clean instruments, because I'm pretty sure if I have gloves in here, it's because I'm gonna do a video on cleaning instruments. That's exciting. Okay, so let's go to the bag here. In here I have tape. Looks like that's the kind of tape that you use when you put in the you cover the instruments, and then you put them in the sterilizer machine. This is against steam indicator, and of course Sharpie, and the towels or the papers to fold the instruments, or to cover the instruments. That way they're sterile. Okay, as that, I got bags. Yay! Okay, so we have the autoclaving pouch. That's what it is. And they have different size for different size of instruments. Okay, we have the small instrument. Okay, I gotta see what kind of small instrument I can put in here. Like I say, I haven't opened yet the instrument box, but I will by now. So I'm sure I have a few of small, medium, and large. Okay, so this one, you put the instruments in, you take the peel off, and then you seal it, and then you put it in the autoclaving. Okay, good. Like that. Sterile towel. These are for the OR. Sterile towel. How many do I have in here? Looks like I have 4. So 4 towels in here. Okay. Some of those are disposable. Let me see. Is this one? Yeah, it is disposable. Good. Because in some hospital, like the ones we used in here, they're reusable. So we send them back and be sterile and then reuse them. Another one, so I have 8 towels in total, disposable ones, okay? Nice, I like that. Brushes, okay, nice, look. I have a nice long brush for all those lumen. Okay, I have a sponge, and these are for, you know, to sterilize or to clean your hands, to wash your hands. And then a measuring syringe. The syringe is usually to measure how much of liquid to clean the instrument. You know, if you have the OPA, you gotta measure how much liquid you're gonna use to clean the instrument. And also we have those little straws here, again, to clean those hard to clean instruments like the lumens, like holes kind of thing, like the cameras. So those are good for that. Okay, those are only a one-time use, and then you can throw them away. Okay, I have a total of 30 scrub Providone ionized, so 30 of these ones. Okay, these are good for cleaning your surgical area. Okay, or cleaning your surgical area. Your hands. Okay, cleaning all of your hands before you touch the patient. So 30 of those in here. Yep, a lot of them. Now I got cards, the flashcard. Okay, so like I said, I haven't opened it yet. I don't know what has in it, but I'm sure it has like information on the instruments and the meaning and how to use them. So I'm excited about that. I cannot wait to open this and start doing what I need to do on this one. Okay, and now the fun part. I was kind of looking forward to this one. The bag full of instruments. I have a list, and that comes inside the bag. There we go. Nice. It tells you the name of the instrument, and that's if they, you know, the quantity, how many I got in there. Okay. All right. I'm just gonna show a few of them. Right. I'm gonna pick a few of them and see. They look exciting. They look fun. Now I know like what a child feels sometimes when they get their Christmas present, right? Happy? I think that's me. Alright, so nice. This one is a, ooh, can I open this one? A tonsil. It's a Schnitt tonsil forceps. Okay, so here, let me open it. All the instruments, they gotta be open by this side, especially if they're sterilized. You know, let's pretend this one is sterile. If they're sterile, you gotta open them through this side and make sure that when you open them, you open it sideways, this way. Of course, this one is not gonna open because it's plastic, right? But the way to open it, if they're sterile, you cannot just rip the paper sideways this way. Don't let the outside touch the instruments, and then you pass it on to the, you know, if you're doing an office procedure, an example, you pass it on, but you always make sure that you kind of bend it without the instrument touching the outside of the paper. Okay, and then of course your surgeon is gonna grab it. Okay, and that's it. So anyway, this is a Schmidt tonsils forceps. Okay, so this is hold to grab, for grasping, okay, or to hold like a blood vessels too, right? If you're doing a suture, you can use this one too for that, to hold the needle and flip. So when will you use this? When you have to close a wound. Okay, that's that one. This is fun. This is an Alex. It's a small one. Looks like an Alex. It is. A tiny one. I'm used to seeing the big one. We have the big one in our department. So again, it's an Alex. And an Alex, they use it, you know, just an example in here. We use it for when the providers do like an endometrial biopsy and they want to see better at the inside of the cervix. They just tight cervix and that helps to contract and open up. And so with the Alex, they kind of pinch it. And it's kind of nice because this one doesn't make the patient bleed a lot. But if you use the tenaclin, which I cannot find, where are you? Do we have one? Did we get one? I don't think we got a tenac. Anyway, I thought I had a tenac. Maybe I mislooked. Anyway, I don't have a tenac. A tenac is one instrument that has two sharp T at the end. And so the tenac also serves the same purpose, but on that one, it makes the patient bleed a little bit. And so some of the providers use it, but other providers, they prefer to use the Alex. This is the Alex tissue forceps. Okay, so like that one. Let's see here. We have. Okay, this one, I think this is, yeah, this is a reinforced set, right? A Forster sponge stick. Okay. See, I thought it was a reinforced set because it looks like it, but it's not. It is similar though, right? But this is, they use it for, to clean. So they grab the sponge with this and then they just start cleaning around the incision where the incision is gonna be. So that's what it is. So I have my 4 instruments in there. Okay, that's it. Okay, so now I have the cards right here, or the flashcard. Okay, there are many of them. So I'm just gonna pick, instruction says to pick 4 of them. I hope I know! So, 1, 2, 3, 4. All right, so I have all of them in here. There, it's hard to get the whole picture in there. Anyway, my 4 cards that I picked. Oh, okay. These are the first card. I picked this one. Okay. It says, what's the name of this instrument? What structure is commonly used? Okay. So by looking at it, it looks like it has T. You can see it right in here. It has the little T. Okay. Could it be like a? I think I did a paper on it. It is Edison. Oh, in the back it says, oh, well, it's an Edison pickup with T. I guess I got the T right. And then this instrument is commonly used to closing the skin with suture or with staple. So you grab the skin and then you use that hemostat that I have before the forceps, and that helps to close the skin, the suturing. Okay, now I have this long instrument here. Okay, I think we have similar one in here in the clinic, not so skinny. I think we have a big one. Okay, what is the name of this instrument? What is the function purpose of this instrument? It looks like it's a instrument to do like a biopsy The one that we use here at the clinic, we used to do like vaginal biopsy. So what's the name of the instrument? It's a flexible cup biopsy forceps. Ah, okay. And then what's the function and purpose of the instrument? The flexible cup biopsy forceps is used to take bladder biopsy from the bladder wall. Okay. I think this one they use it with a camera. Okay. Next one I have towels. Those are the sterile towels that we use for the OR. Okay. You can use this on any procedure in the OR to clean, and they have to be sterile. Okay. So surgical towel. What they're used for, multiple purpose. Covers the barrier on the Mayo stand. Okay, so this is, let's pretend this is the Mayo stand, so we cover the whole stand out with the surgical towel. Okay, as well as used for establishing a sterile fill when draping. So we know that. I know that now. Okay. This other one. What is the name of this instrument? Okay. Also has T. So it's similar to the first one that I got. Yep. Did I get two all the same? Okay, looks like I did. So this one, it is the Brown Edson tissue forceps. Okay. It is it's used for plastic surgery procedure, used for wound closure, grasping delicate skin edges, and it's automatic, and they grasp and hold without puncturing or crushing the skin. Nice. There we go. Okay. So I hope I got it.